communication between partners, the open and honest relationship is what leads to the best kind of sexual health and enjoyment. So I think
now I want to bring you back to talk about pelvic pain when it's atrophy, perimenopause, menopausal, dryness, stenosis type pain. You know, maybe you've dealt with prolapse, you've had bladder sling procedures or urinary procedures, or you're dealing with chronic constipation, and just the changes that happen with hormones and time have caused pain with intercourse. And as I always say, that if you have pain when you do something, you will not want to do something as pleasurable as it may have been, right? And that comes to intercourse too and sexual health. So Dr. Shakandi, thank you again for all this amazing information. Let's talk about these clients who are perimenopause and menopause and are struggling with atrophy and pelvic pain. And I mean, I've seen as a gynecologist taking care of generations of clients, right? That the stenosis of the vaginal floor and the prolapse issues, and I mean, different changes. Some will have such relaxation, others, the vaginal walls will change to really become very stiff over time and impenetrable, so to speak. And so those are, I mean, that causes pain. It causes pain with waking up and you know, going to sleep, let alone having fun or play or sex. And one of the big issues I tell my clients is, especially with bladder pain and incontinence that results as we get older, estimation of 80% of us will experience incontinence at one time of our life. But it is the number one reason, incontinence is the number one reason why a caregiver will put their loved one into a nursing home, right? The number one reason. This is all related to the pelvic floor. That is why pelvic floor exercises, pelvic floor health, postpartum care is so critically important. So let's talk about like when we need to use dilators, what's the issue that's happening there, and how you help some clients in the perimenopause, menopause.
Yeah, so it's a cumulative effect, starting from your age 20s, going through your whole life to postmenopause. So everything you're doing early on can only benefit you long term, because it's that repetitive kind of micro trauma. And you know, the pelvis is the core of your body, right? It has so many it holds up all those important organs, right? It holds up your bladder, your uterus, your descending colon. It has to function so it can support all the joints and your lumbar sacral spine, your hips. So it's a cumulative effect. So start young, and you know, your postmenopausal days are better in terms of function, exercise, lifestyle. And then also it's a really important point where in hospital, in the rehab hospital, it's for anyone over 65, it is that UTI, which are correlated with urge incontinence and incontinence in general, right, with repetitive UTIs, so which can cause, you know, patients to require to be in a rehab earlier on in their life. So
when we say urge incontinence, that's like, oh my gosh, I need to go to the bathroom, and you go and you really didn't have to go very much. It's that feeling like you need to go, that urgency symptoms. That's why it's called urge incontinence. Stress incontinence is when you cough, sneeze, laugh, exercise, and you leak. And so those are the two most common causes, but we all really associate urge incontinence, urgency incontinence with, you know, pelvic floor dysfunction.
Right, exactly. That's exactly right. So in terms of, perimenopausal, postmenopausal, of course, there's that strong kind of hormonal component as well. So it's important to work with your gynecologist to make sure it's all assessed and we have the right hormonal balance. So experts such as you, Dr. Anna. This Julva cream, particularly for perimenopausal, postmenopausal, but really postpartum anytime, is excellent to apply really at the vulva, so at the external opening, as well as that perineum. So you can massage it, and you can go up into the vagina because it is all natural. But it is important to lubricate naturally and to provide kind of that plumpness to the tissues, because they're tissues just like anywhere else, just like your face. So you need to provide that hydration as well as that resetting of what we call the pH balance to prevent, you know, yeast infections and things. So it's really important to not ignore the skin down there.
I would say that's the most important real estate of our body, right? Clitoris to anus. Those are the most important real estate, and that's where we use Julva. So,
So
yeah, thank you. And I know
super helpful.
been getting a lot of good results.
And then here we have dilators. We use this for something called vaginismus, particularly is the most common, but really anytime we also want to hold progress, right? You did our protocol, we saw you back and you're just doing excellent. So quite often we'll recommend a specific yoga program. Your Pace Yoga is excellent, where you really want to keep that muscle nerve connection going and keep your pelvis open and not clamped down, right? So the yoga is great. In addition, the dilators are fantastic for when you're doing maintenance or during vaginismus. Vaginismus is when, you know, it's really challenging to have penetration of anything, tampons, a penis during intercourse, because your muscles just clamp down around it. So this progressive use of the dilators
sometimes won't let the penis inside the vagina. So
right.
I remember seeing a couple came to me on St. Simon's, and they were on their honeymoon there, and they were emergency work-ins. They're on their honeymoon, first time trying to have intercourse, and they're like, we can't, like, there's no way. And so immediately teaching, you know, as an osteopathic medical physician, I trained in doing some of this, and then working in OB, then being a mom myself, right? Learning pelvic floor relaxation techniques, some muscle energy techniques to really work on relaxing the pelvic floor, and showing him as a partner how he could definitely, you know, just put, you know, one finger, then two, and gently try to relax the pelvic floor and try to work through initially, but still there was a lot of work to be done.
Yes, I love how you're bringing in the partner. Really important to do that. The communication between partners, the open and honest relationship is what leads to the best kind of sexual health and enjoyment. So I think that that's very important, and have them work together. But you're right, sometimes really penetration is not an option, so we start slow. I mean, that's the key. And we'll put the Dulva cream around it quite often, so it's more comfortable. And this is kind of what we, you know, the smallest dilator, and you don't want, you know, you start with what's comfortable for you. So it's based on, you know, working with your healthcare provider to see what size you want to start with. And then we slowly get bigger, right? So this basically you just keep increasing the size, and then this is kind of the largest size. But you know, it's exciting. Patients come in, they're like, Dr. Shrikande, you know, I'm now on, you know, medium plus, where you started off, you know, the smallest one. So it's really cool to see your progress, which is why I love the
color coding,
the different sizes.
Purple.
And, yeah, you exactly. And you know what? Patients, you're working hard, so you know we congratulate you every time.
Okay, but now what is this one?
So it's the difference between the dilator and this is what we call a wand. Dilator is straight up, and with the dilators, you want to start, of course, superficially, but as you improve, and particularly once you're really significantly better, what you do is you do go in and you hold for 5 seconds. You go in and you hold where you kind of feel a tightness in the muscles of the pelvic floor, 5 seconds, all right? And then you go to the next spot. You go in and then you hold for 5 seconds with this. So it's continuously keeping the muscles open, right? Reset that muscle. So it's helping you do your own really pelvic floor PT work. It's self-efficacy. You can, you know, it allows you to treat yourself. So that's how you use the dilators. Okay, you go in and you hold it, and then you go around. We call it the clock, and you keep finding spots that feel a little tight and restricted. Put pressure, hold for 5 seconds, and then go to the next spot. You do it at least once a day. Takes about 10-15 minutes. Doesn't take that long, and it really, really helps maintain all the progress. So they're amazing. Now, why do we use this? So this is called a wand. The reason why is, if you remember the model, and when you go inside, a lot of the pelvic floor issues are lateral towards what we Alcock's canal, right, which is what we focus on with our procedures. So when you go in with the wand, it allows you to get lateral, right, and hold, again, your progress really along where the pudendal nerve is, and also the posterior femorocutaneous nerve around obturator canal. So it allows you to go into those different canals of the bony pelvis and really keep it open as well, and do the same thing where you're holding for 5 seconds. And really what it's doing is increasing blood flow to that area for 5 seconds. So that's why we have the curved. Usually we start with the dilators, and we only move on to the curved when we feel patients are ready for it. So it's a discussion between your pelvic floor PT, your physiatrist, as to when you kind of want to transition to the wand from the dilator.
Obviously, I could be talking to Dr. Shakande all day long. There's so many topics we want to discuss. So, I'm going to have her back on the Girlfriend Doctor show. And Dr. Shakande, I want to thank you for your time and energy here and all the work you're doing and helping women and talking about this as an uncomfortable topic. But we have to talk about it. We have to address it.
Mm-hmm.
No living with pain. Can you guys say that as you're watching this? No living with pain. And we are going to get to the root cause of what's happening and take that whole lifestyle approach to healing our body, getting rid of inflammation, no matter where it's attacked us in our body. But certainly like this area is so special, and to have like kind-hearted, amazing physicians here as part of the Pelvic Rehabilitation Medical Center, and just what you're doing, being able to get to the very integrative approach that needs to happen in dealing with this problem. Deborah thought she'd never be able to enjoy sex again until she tried Julva, my all-natural anti-aging cream for your delicate feminine parts. She had tried all sorts of herbs and oils and even estrogen, but nothing worked as well as Julva to rejuvenate her feminine bits and bring fireworks back into the bedroom. Well, find Julva at dranna.com and use the code SHOW10 to get 10% off your first order. Thank you for watching this video. Be sure to subscribe to my YouTube channel here and get those notifications, and comment below. Let me know your thoughts, what you loved, and what your action step is.